Hey everyone, it's Ray, back for another video so soon. My pronouns are they, them, or neo-pronouns, and today what I want to talk about is more of a vent post. If you see my other videos, you may know that I'm a medical student, and so I learn about a lot of medical things. that's a terrible way to put it, or maybe not. It's just a very simplified way to put it. So, as many folks know, medicine can be problematic. So what I'd like to vent about today is one of the not the only, not the most, but one of the most upsetting, problematic, derogatory things that continues to be taught in medicine, and that I encounter all the time, and it sucks. So content warnings for today is talking about specifically medical violence in relation to intersex people, and I'm not gonna say the language used, but I will be talking about it and also talking about alternatives and how we should be discussing intersex patient populations in a good way and a healthy way, using more of like a community informed model. Anyway, I think that's basically it. So medical violence, anti-intersex violence, anti-intersex language discussion. I'm gonna avoid using like the actual terrible terms that are used, but I will be mentioning that there are terrible terms used, and then providing like the actually appropriate terms that we should be using as future healthcare professionals and as people. Like, this applies to anybody. When you're talking about folks who are intersex and you happen to be talking about like the ways that they are intersexed, if it's even applicable, because also we need to remember that intersex people are also just people. So let's be respectful of that and knowledgeable. Anyway, so I feel quite strongly about this. I am not intersex, to get that out of the way. A lot of times when I talk about like other people, populations, folks are like, oh, so you must be part of that population. I'm like, no, I'm an ally who cares, and we all should be talking about this, and you don't have to belong to that group to want to educate yourself, and you should educate yourself, and you should care. So I care a lot about a lot of groups that I'm not a part of, and so I'm going to be linking in the video description to a website called Interact, and they're an advocacy group that advocates by and for intersex individuals, and I'm going to link specifically to some of their forums that they have where they explain good and bad terminology, ally do's and don'ts, generally what it means to be intersex. They have some amazing resources, amazing people, intersex people who actually are running that organization. They've done some amazing work the last several years. So for medicine and medical school, one of the biggest things I've encountered, and keep in mind, I'm only a second semester student, like just starting into my second semester, and yet there's been so many examples already of how often anti-intersex language and thoughts come up. Like, you would not think for like, and it's not that intersex people are rare. They're not. In fact, approximately the estimates are about 1 in 7. Okay, the statistic might be wrong, but approximately the same number of people born with red hair every year, babies. That's about the rate that people with intersex traits are born. And people with red hair, we see them. They exist. They're definitely like a notable number of people in that group. So same thing with intersex. Not uncommon. However, in terms of like, they're not like super common. So it's amazing how many opportunities professors work in to use terrible language about intersex folks, considering like, one, being intersex, it's a different way of folks developing. Now sometimes, let me back up. What is intersex? I've talked about this a little bit in some other videos. Also, I will link in the description, like the definition by Interact. So intersex is an umbrella term. It refers to basically ways that people are born and develop that don't necessarily fit neatly into the box of what we would traditionally think of for folks with XX or XY chromosomes. And also that can also include not even just genetics, but there can also be different hormone profiles, how people's physical appearance develops. So for instance, chest development, genital development, and how folks are born as well. It can just vary, and it's outside of the box that we consider to be typically expected, which is not to say that it's always and certainly often not really something that we have to fix. It's still normal, and what I mean when I say normal, it happens so frequently, right? In the same or similar frequency as people born with red hair. So in that way, it is actually somewhat expected that it would happen sometimes, right? And so the big problem is, and here's some mentions of medical violence, is for a common theme in medicine is that doctors will prescribe unnecessary treatments and surgery to try to correct the intersex children being born without consent, without informed consent to the parents, or sometimes the parents will request it because the parents think that their child should look a certain way. There's also often like gender norms attached to it, so they try to correct the gender or the sex, which is not something you ever need to correct, and you shouldn't be. You should wait until a child is old enough to decide. There should never, ever, ever be an unnecessary medical procedure performed on a person too young to consent. That's violence. That's unethical. And it's horrible. And it leads to some very serious and long-lasting effects. And specifically when it comes to the genitals of a person, if you perform an unnecessary medical procedure without consent, that is genital mutilation. It's considered a form of torture by the United Nations and has been for a while. Unfortunately, it's also legal in most places. And we continue to extend the problem because in medical schools we have these professors who are not community informed, do not really understand what intersex is, and they treat it like a disease. And so here's the thing. Sometimes there's lots of different variations for intersex people and traits, like, and sometimes things go missing when folks are intersex, like certain enzymes, which are like chemicals that help reactions happen. Certain hormones go missing that are important for things like blood pressure regulation, salt retention, like things that help keep us alive. Treating that particular aspect, making sure folks stay alive, absolutely, we should learn how to do that, and that is important. That's necessary, yes, but it's not necessary to correct anybody's physical appearance just to conform to a gender or sex norm. And that has very, very serious and horrible consequences in folks, both physically and mentally. So for me, it's really frustrating because I was just watching this lecture last night. Well, I wasn't watching. I just read the notes. Um, and it was a lecture I've seen many, many times before. In this case, it was about steroid hormones, just a type of hormone that folks have, or well, it's a category. There's many hormones that are steroids. And they started talking about folks who are intersex, and using really outdated and derogatory terms to describe folks who are intersex. And I've seen this happen many times. And when we do that, when we describe folks using derogatory terms that are considered by the community to be derogatory, and we make that the norm, not only do we pathologize parts of people that shouldn't be considered a disease, but we also teach our physicians in the future to carry that over, and we teach them that something is inherently wrong with this person. It needs to be fixed. And that's not how we should be treating our patients who are intersex, especially when they're so young. And we need to treat our patients like individuals, and when patients are babies, we can't ask them, how would you like to be treated? What if you have parts of your body that you're not comfortable with, what is the best solution that we can come to collaboratively with you to determine how you can feel most comfortable in your body? Because they may grow up and they may tell us their body is perfectly fine and they would change nothing. And they may grow up and say, yeah, actually, I am really uncomfortable with this, and I'd like to seek some supportive resources either to figure out, how I can become more comfortable, and or if I can make any changes. And doing that with informed consent is fine. Doing it on babies is violent. So when we have a medical school teaching students to view all intersex traits as disease processes and something to correct, and we use these slurs to describe it, it's all violent. And it may seem so harmless now just to use words, but it's not. It's really about the concepts and the intentions behind the words, and what that can lead to down the road when we're actually doctors and we're actually treating intersex patients, or we're talking and educating the parents of intersex babies, and we're advising them on what to do, and they're asking us if anything needs to be corrected. And if we come out with these derogatory ideas, it's just really not gonna be good for anyone. So my suggestion to anybody in the medical field, especially, because there's a lot of power that comes with being a healthcare provider, especially being a doctor. You have the power to prescribe treatments, you have the power to gatekeep, you have the power to do a lot of harm if you're not educated about the community needs, and if you're just going off of some outdated stuff that you learned in medical school. So my advice is go to the Interact website that I provided. Stop using outdated terms. By and far, what I've seen from many, many intersex folks, the community preference is the term intersex. Move away from anything that's not intersex, the term. Unless, of course, if your individual patient says to you, this is the term I use for myself, please use it for me, that is the case where you can use that term. Anything else, if it's just talking about the whole population, use intersex. If a certain category of diseases is using some outdated terms, change the terms. So for instance, there's a group of diseases a group describing intersex development and variation, which includes some problematic processes that do need treatment, such as what I talked about with blood pressure regulation. Anyway, so there's a group called the two groups. There's a 46S XX and a 46XY intersex development. That's what I call it. That's not what most people call it in medicine. And what it refers to, the 46 is a number of chromosomes. So each human being has like 46 chromosomes. So 46 just means you have the correct number of chromosomes. XX or XY refers to those two specific chromosomes that typically determine how our bodies develop, especially our genitals, our reproductive organs, our chest, some body hair. So like on those chromosomes, that's where we get that information from. So 46 XX or XY says that we have 46 chromosomes and this person is either XX or XY. And then there's usually a term after, usually a problematic term, but in this case I use intersex development. So what that tells me is, reminds my brain, hey, now we're talking about a category of development in which somebody who is either 46XY or 46XX, they are developing in a way opposite of what I might expect, or different from what I might expect. It's not always opposite. It is a spectrum. It is fluid. Bodies do not work on extremes. So actually the term opposite is not even the correct way to use. They're not the correct term to use. So for instance, if we have a person who belongs to a category that is 46XX intersex development patient population. So what that reminds me is, okay, so this person has a normal amount of chromosomes, 46. One of their chromosomes is XX. However, their body and the internal processes of their bodies is not going to be quite what I would expect for an individual who usually has XX chromosomes. And this is especially applicable for young children and babies. And then I can go through like, okay, so here's some of the things I'm seeing, and if there is any interventions needed for that particular group, then it like helps me narrow down what to look for and then like how to approach that treatment. If it's just physical appearance and there's nothing else going on, there's no intervention needed until that child is old enough to say like, hey, this bothers me, can we talk about it? Not too hard. Shouldn't be too hard. And what's also frustrating for me is I've had this conversation with professors many times last semester, and to have it, and then I thought I finally got through. I spent so much effort and I was not heard for so long, and it is really upsetting to me because, you know, as violence should be, violence by healthcare providers who have so much power against a marginalized group of people should be upsetting to anybody, right? So it's so hard that I worked to try to change our curriculum last semester and then just to see it come back right back where we were with a different professor. Like the professors are not communicating and it's just so hurtful. And I can't even like go directly to my classmates and say like, hey, here's some information, because my posts keep getting deleted when I share things, and I've gone to the student government about that, and they say that talking about sharing information about marginalized groups of patients and how we can best serve them is not related to medical school. That's also been told to me by admin. They said it won't make you a better doctor, we're not interested, we will not be allowing those posts. So they just delete my posts, which is a whole other bottle of discrimination and horribleness about medical school. And it's not even just this medical school. Like this is the second medical school I've been to. I have other friends in medical school who have encountered similar things. So this is not just a one-off, you know. Anyway, that's my rant for today. Much longer than I expected, but I'm upset, and this is my advice for anybody watching this. Check out the resources. Thanks for listening. let's hope things get marginally better. I am meeting with a class representative later this week to once again try to create like a more permanent solution. I'm going to talk about like, hey, here's the problem with these lectures that we just had. I've already had this conversation with faculty, so can we work together, like from your side as a member of student government, which I know it didn't go so well the last time, but we'll try again. And then from my side as a student, and like, let's combine our resources. So wish me luck. I don't have high hopes as usual, but I would feel remiss if I did not try, because it's just so upsetting and something needs to be said. Okay, yeah, comment if you have any future videos you want to see, or use the anonymous feedback form, Google form that I put in my description, or if you just want to give support. If you have some anti-intersex comments, you should keep them to yourself. Thanks, because I'm not in the mood, and nor is anybody else. And also, if you have some anti-intersex sentiments, you should go read the resources from Interact and educate yourself so that you can hopefully change your mind to the more correct thinking. Cool. All right, y'all. Thanks for watching.